Welcome to our foot topic chat. Today we're going to talk about skin problems and what to do. My name is April. I'm a foot care nurse with the Wolf Creek Primary Care Network out of Lacombe and also now Ponoka. If you don't know what the Wolf Creek Primary Care Network is, we are your healthcare team for Lacombe, Ponoka, Sylvan Lake, Innisfail, Rimbey, Bentley, and Delburn. Our family physicians and healthcare professionals handle all sorts of your primary healthcare needs, okay? So ask your physician about a referral today. So today we're going to start with talking about dry skin, calluses, or cracks to the bottoms of your feet or your heels. So what do you do about that? So first, you do want to file your heels, calluses, or cracks with a clean heel paddle or emery board file. Every other day is ideal to reduce that crusty buildup, okay? This does work better when your feet are dry prior to showering. If you can do this, once a week, you are still doing great, okay? You do want to apply some lotion to your feet twice a day, but no lotion between your toes. And if your skin is really dry and really cracked, like this one picture on the left, you can apply a lotion that has urea in it. I would look for something with 5 to 25% urea in the ingredient list. Some examples are Flexitol, Urimol, Dermal Therapy, Attractane, and those are over the counter in the drugstores. And those are more, with the urea, that is more for the dry, calloused, cracked skin, okay? You do also, you want to be wearing clean socks, okay? That's very important. After you put lotion on your feet, it is good to put some socks on for, an hour or so after. You can see top left corner, a long-handled heel paddle to reach your heels. And the middle picture is kind of a cheese grater looking file, and those can be quite dangerous, especially if you have diabetes, so I wouldn't necessarily recommend using them. So let's move on to athlete's foot. What is athlete's foot? It is a fungus that causes itching, redness, and cracking, peeling skin commonly between toes and under the toe, usually in between the fifth little toe, okay? So you need daily washing and drying. You have to do that well between all toes. You want to have clean socks on each day. You may need to see your doctor. He may need to recommend a medication for the athlete's foot if it's not getting better with good hygiene, washing and drying, okay? There are some over-the-counter antifungal creams as well that you could try. And again, clean socks every day. And when you're sitting down, don't feel bad about taking those socks off, letting your feet breathe. And of course, don't put the lotion between the toes, okay? We don't want that moisture sitting in between there. So moving on to corns. So some corns are soft and some are hard. What is a corn though? It is a buildup of hard skin, usually near a bony area of a toe or between the toes. Corns can be a result of pressure from shoes that rub against the toes or cause friction between the toes. So proper care is definitely necessary if you do have a corn. So what do we do about that? After you have a bath or a shower, you can use a pumice stone to gently remove the buildup of tissue. I wouldn't recommend using over-the-counter remedies to dissolve the corns, okay? And do not try to cut the corn out with a sharp object, especially if you are someone that does happen to have diabetes. First of all, a corn will likely keep coming back if you are wearing poorly fitted shoes or if your toes continue to rub together, okay? There are different toe spacer options available in the drugstores, and we do have some more information on this here on the next slide here. If you look here, those are some different toe spacer padding options, and there's many more, okay? They come in silicone, sometimes they're foam. The one in the middle is a toe crest. Check out your local drugstore. They do have different options. But of course, you definitely want to address the shoe issue first. You know, is it my shoes that are causing the corn on the top of my toes from rubbing, or the bottom? So we're going to talk a little bit about foot ulcers or foot sores. What is a foot ulcer? It is a break in the skin or a deep sore, which it can become infected. Foot ulcers can result from minor scrapes, cuts that heal slowly, or from rubbing of shoes that don't fit or support your feet well enough, causing a callus to build up. Early intervention is definitely important in treatment. Ask your doctor for advice on how to best care for your wound if you do have one. I want to mention calluses can often lead to foot ulcers or sores, especially if you do have diabetes. Foot ulcers and sores can lead to infections and toe or foot amputations. We don't want to go down that road. 85% of foot amputations can be avoided through good foot care and footwear. So it's really important to have good shoes and to be checking your feet every day. If you are someone that does happen to have diabetes, you want to make sure that your feet are looked at every year, okay? It's important to get, you know, a diabetic foot assessment done, foot screen once a year, and that is something our primary care network can help you with. Another thing I want to talk about is cellulitis. It is a bacterial skin infection. It usually follows a breach in the skin, such as a fissure, a cut, a laceration, an insect bite, or a puncture wound. You can prevent cellulitis. If you look at these pictures here, you notice the redness, okay? So signs and symptoms of cellulitis, we have the swelling, we have the redness, warmth, pain. Sometimes there's a fever, you know, signs of infection, okay? If you have the redness going on, trace it with a pen so you can keep track to see if it's spreading. Prevention. You want to keep the skin well hydrated and prevent your skin from cracking. You want to protect the skin against injuries or activities that may puncture the skin. Definitely good footwear. Wear long pants and use insect repellents when you're outdoors. These pictures here, especially the leg ones, you definitely want to see a doctor before it becomes urgent and gets to this point, okay? Because it's likely at this point, you know, you need to be in the emergency room and receiving IV antibiotics. You don't want to get it, you don't want to let it get that far. You are higher risk for cellulitis if you happen to have that paper, shiny skin look. So that's cellulitis. We want to avoid that. Just a little bit on some photo credits here. And again, thank you for joining me to talk about feet. I love to talk about feet, and we have some awesome foot care nurses in our Wolf Creek Primary Care Network. So feel free to ask your doctor for more about us. Okay, thank you again for joining me.